So once again, we are with Dr. Cooper, our star. Dr. Cooper, let me begin by telling you that the first episode of the Care OACES has been crushing it. How do you feel about it?
I feel fantastic. I mean, this is what we wanted. We want to get the message out there as a platform that can be a resource for people to access healthcare, health information. Access is a two-way street, quite frankly, because as a provider and a physician for over 30 years now, oftentimes I'm limited by recall and other issues, the lack of interoperability in healthcare. So I think it's fantastic. So it's exactly what I was hoping it would be.
That's wonderful. And this is Breaking Barriers. This is episode 2. We are going to talk about how to navigate healthcare challenges and access quality care. And Dr. Cooper, I'm going to call you Dr. Coop. I feel like we're friends now. So,
Ursula, you can call me whatever you like. I really feel that way. I mean, I connected with you so fantastically well in the first episode. I told Vivek I have to have Ursula every time we do these interviews because she and we're resonating. It's called resonance. And when you resonate with someone, that's very, very important in terms of your spirit and your intentions and your passion coming through. So I feel you, if I could say it that way.
thank you so much. That was really touching. Okay, so I don't want to cry. So let's go to the first question, Dr. Cooper. Access to care is an issue that is constantly in your work. Why do you think so many people struggle to find the care they need, even in today's world where medicine is so advanced?
Yeah, Ursula, that's a very good question. But despite the incredible advancements in medicine, systemic barriers persist. They include disparities, geographic limitations, and complex health systems that overwhelm patients. Often access to care depends on factors like insurance coverage, provider availability, and patients' ability to navigate these systems, which is not always intuitive. And in many cases, we prioritize innovation over accessibility. Innovation doesn't necessarily mean accessibility. And this leaves large populations underserved. As a healthcare professional, I see this not just as a systems issue, but as a call to action to make healthcare truly inclusive and accessible on many, many levels.
So, I was going to ask you, because you've seen this issue from both sides as a patient advocate and as a professional. So what are the biggest barriers that patients face when trying to access quality care?
Oh, yeah, I think cost is the first barrier. And it's not about whether or not they can come out of pocket, but whether or not I'm covered with my insurance or lack thereof, quite frankly. Next is availability. It's a significant issue. Providers are so concentrated in urban, large cities that leave sometimes rural and underserved populations with very few options. So you imagine now, even if I'm in a big city, can I afford it? We've got all these great, fantastic healthcare resources in my city, but if I can't afford it, that's one issue. Now, just imagine if you're outside of these large MSAs across the United States, in particular, for example, where, there's few people in my little small rural part of America that have access to these, even quite frankly, in a lot of cases, very basic healthcare services. And then we have to acknowledge the fact that there are inequities tied to race, ethnicity, socioeconomic status, beyond just geography that create significant gaps in healthcare delivery. So these barriers are compounded by the fragmented nature of healthcare, where patients have to navigate multiple systems that often don't communicate with each other. So we have the issue, quite frankly, of interoperability. If I go to see a provider at my local Walmart, which is ubiquitous across rural America, but then is that information going to be transmitted to the big city where I may have to be treated later on for a much more serious condition because it's not available locally for me? So these are some of the barriers that exist for patients as they try to access health and healthcare services.
So, Dr. Coop, you know that many people talk against technology, but how do you see tools like telemedicine or apps like the one you're building with OACES Health helping to break down these barriers that we were talking about?
Yeah, so tools like telemedicine and apps like OACES, the Care OACES and OACES Health are game changers. Telemedicine removes the geographical barriers that allow us to connect to patients and connect patients and providers from the comfort of their homes, quite frankly. So apps like OACES Health go further by integrating patient records, wearable data, telehealth services into one platform. That's where we are going with this. So this creates a seamless experience where patients can schedule appointments, access medical history, and even get second opinions, all while eliminating much of the inefficiency and confusion that traditionally comes with accessing care. So you just imagine being able to pick up your phone, which 90% of us are tied to, and being able to hit that button on the OACES app and basically get answers to your questions as well as access to the actual care that you need. That's where we're going with the Care OACES and some of the other initiatives that we're implementing with our platform.
I am a fan of technology, but you know that some people feel uncomfortable and they think that the doctor is not going to be paying as much attention because they're not together, and they feel it's not going to be as personal as it would be if they were together. How do we break those barriers? How do we explain to people that technology is a good thing and that you can have a great consultation even though you're not with the doctor like at his office?
Yeah. So just remember, we start again at the beginning. We have examples of how technology and this trust in technology can be developed. Just look at the financial industry. Right now, the vast majority of people in America actually access their financial data through their banks, which is something that all of us use every single day. And guess how you do that? You do that by simply putting your ATM card to pay for a burger at McDonald's. Think about that. There's so much information that's transmitted in that one transaction that will just make it would be mind boggling. So the reality is that we've created trust throughout our society and our cultures, in other areas where we freely give up that information. Okay. But unfortunately, what healthcare, we're so far behind the eight ball when it comes to building that trust. In fact, we have to get back to the very simple fact that oftentimes people don't even trust the doctor, okay, because they've been mistreated, or had bad outcomes. They've been told things that didn't happen. Well, when you go to McDonald's, you swipe that card, you're going to get your Happy Meal, okay? It happens, and it's very consistent. The taste is going to be very, very consistent. It's a consistency, okay? And so I think that technology, quite frankly, has the ability for us, and particularly as we layer artificial intelligence on top of this, the ability for us to create that consistency in an expectation and an outcome for what we do. Because oftentimes it's not that you need, for me as a heart surgeon, to open your chest, or you've been given some serious diagnosis such as a brain tumor or something like that. No, you want the basics, and the inconsistencies in the basics they're just that. So people come in and they don't trust. They have no idea what they're going to get. So if we can use technology to create consistency as a foundation for building trust, then I think we've taken a major leap forward. But we have examples out there. The banking industry, quite frankly, the social media industry. People go out there and they create these profiles on social media every single day. And they have no idea that what they're giving up, quite frankly, is information. Okay? Information about them, information about how they interact with the world, how they interact with their friends, quite frankly, how they spend their money. But it's an intuitive trust, because they know when they go on that social media site, that they control it. They can turn it on, they can turn it off. Okay? There may be inconsistency in terms of when they post something and somebody may not like it, but they already understand that. They've been trained. We have an opportunity in the healthcare industry to help people navigate this very, very discombobulated and disjointed system by creating trust through consistency of delivery of action, information, and access.
Okay, let's move to question number 4. I did feel like that was something I had to ask you because many
So thank you so
people.
much. I had no problem with that. I recognized it was not on there. So let me pull question number four
Yeah,
in. I thought that was fantastic, by the way.
good. I'm glad.
Okay. Let me see here. Okay, we're coming with question number 4 now. Okay, great.
So, Dr. Coop, you just mentioned the amount of information that we have in the world. And I think that a lot of patients do not know where to start because they hear so many things, they see so many things. So, how can they use these tools effectively to actually take control of their healthcare journey?
Yeah, I think that's a very good question. And, to support what I was just saying and how I talked about creating and building that trust, I think we have to take it one step further. We have to get to the point where we're comfortable educating um, ourselves as well as our patients. So first, patients should start about familiarizing themselves with the tools that are available. Okay. Most apps or telehealth platforms offer some type of user guide or support. So they use features like appointment scheduling. Very, very benign. Hey, I just want to go in it. Start using those things. Symptom track. Okay, I'm having a call for a headache and a fever. Should I be thinking about COVID or the flu or something else? Reminder, okay, to stay proactive. Okay, so these are ways, and these are tools and features of telehealth platforms and some of these new things that are perhaps foreign to you that you can begin to use in a very, very benign manner that may help you build that trust. But I'm a big believer in the fact that, most people have no idea really about their healthcare history. And so we're working to move in that direction where we can help you keep all of your records in one place, um, that allow you to understand who you are and who you are from a healthcare history perspective. And so that when you go in and talk to your provider, you can ask the right questions. You can inquire about things perhaps that you forgot about that maybe happened to you 5 or 6 years ago, but quite frankly could be very, very relevant today. So technology empowers patients, but it's up to us as patients and healthcare consumers to engage with these tools. This is how you become empowered, and this is how you become and demand, more importantly, Ursula, you demand that your providers partner with you in your health. So often it's a transaction. You go in, the doctor's sitting there, he's looking up at the computer screen and he's typing. Those days are over. It's over because we now have the tools and technology to get us back to, quite frankly, a more personal, although these things seem impersonal. No, they're actually reinforcing the personal side of medicine because these are unshackling doctors from having to sit there and type and play around because now guess what? They're using technology to record the conversation. Okay. Using AI tools that can transcribe. Okay. And the fact that they have your entire healthcare life in front of them. That's in a secure fashion and a very readable format that they don't have to go clicking around all over the chart trying to figure out what was her x-ray last year in a lab 2 years ago. And, no, those days are rapidly becoming passe because technology is bringing us now into an era where we have everything that we need, including the tools right in front of us to build that trust. Okay. But again, I recognize the fact that, healthcare consumers, patients, if you become a patient, you have to begin to familiarize yourself with what's out there. Try these things out. It's okay. Okay. The reality is it's okay. You've already given up a whole lot more of your life than you think you have just by, quite frankly, using that mobile phone that's in your hand, probably as we are talking about these issues right now.
While listening to you, I'm thinking that it's also about taking responsibility because for many, many years, what patients thought is, so I'm going to put myself in the hands of the doctor and they're going to do what they have to do and I have nothing to do with it. And this is about,
Yeah.
hey man, now you got to take responsibility, own it and do something about it, because it's not about just the doctor, but it's also about you.
Yeah, I mean, Ursula, that's a very good point. I can't tell you the number of times that people come to my office and I say, hey, so, Mr. or Mrs. So-and-so, whatever your name is, what brings you in today? She said, well, you've got my record. You read it. I said, yeah, that's true. I do have it. I do have what I have of it, because quite frankly, those records are oftentimes very, very incomplete. I said, yeah, I got why you're here and those things, but I want to hear the story from you. So that's the way that I break the ice on these conversations. You know what? Yeah, they said some really bad things about you. I said, but I don't believe it. I want to hear it from you. And that oftentimes gives patients, it's a way to create that human factor, and it's a way to get them engaged and say, okay, well, yeah, the doc, he's read the story, but now I just want to hear what you have to say about it. Okay. But you're absolutely right about that, is that oftentimes patients and healthcare consumers have given so much trust. We have way too much trust in doctors like me, honestly. But just think about this. I'm taking care of literally hundreds in a primary care practice, perhaps even thousands of patients every year. There's no way, as much as I love you and would love to be able to, there's no way that I can put in my brain, this supercomputer, all of your information and lock it in and just tap into it whenever I want to. Now, we know that that's possible, but it's not a reality right now. Okay. So therefore we use technology to help us with these things. Okay. And so no, you cannot. And I say this to patients every single day. You have to be your own advocate. Okay. And you have to look for healthcare resources within this discombobulated system that are going to want to partner with you to help you be the best advocate that you can be.
Amazing. So, Dr. Cooper, we were talking about old school patients, but there are also some old school doctors that are not really good friends with technology. So, what role do you think healthcare professionals play in making these technologies successful?
Oh, I think it's fantastic, Ursula. Great question. Healthcare professionals are the bridge between technology and patients. We have a huge responsibility to educate our patients about these tools and make them feel comfortable using them. Additionally, we must provide them feedback, okay? Provide feedback to developers to ensure that the technologies address real world challenges. It can't just be about the fact that the healthcare administrators in the hospital want to become more, if you will, efficient and more cost efficient in these things. It has to be about making and having an impact at the bedside. But we have to encourage collaboration, between, our patients and us. Okay. But we also have to encourage collaboration between the tool developers, the healthcare systems and administrators who make the decision to deploy a lot of these systems, unfortunately. Okay. We have to become active participants in the process. Okay. I've been in healthcare for 30 years now, and I've always been one to be very open-minded, one to be accepting and curious about new technology, new developments, new ways of doing things. But I have to admit, that's not the majority of my colleagues, particularly my contemporaries that are at a generational level that I am in the healthcare industry. Perhaps not so much with the younger generation, okay? But the reality is that we're in this nexus right now where my generation is influencing to a greater extent, if you will, or to some extent, the actions and behaviors of younger physicians. I just read an article, and this has popped up in a few forums that I'm a part of, where, the young doctors come in, they don't want to take call and work long hours, and old doctors are saying, oh, well, that's not what you signed up for. Well, you know what? That's not what they signed up. They signed up to practice medicine, to have a great work-life balance, and to be responsible, contributing professionals to the profession and the institution of medicine. They didn't sign up to do the stupid stuff that we did 10, 15, 20 years ago. It doesn't make sense. That really puzzles me to hear physicians say that, because there again gets into the, as you described it, this sort of old school mentality. It's our way of life. Well, let me tell you some old school colleagues. You're dying. You're going away. If you can either decide to get on board, embrace innovation, embrace the future, or you can get out of the way. Because quite frankly, you are dying. You are literally becoming dinosaurs in an industry. Quite frankly, all you have to do is look back and just look at all of the opportunities that providers missed to basically be a part of change, be positive part of change. But we said that. Oh no, I'm not doing that. Oh, we did this 10, 15, 20 years ago. Yeah, okay. Guess what? I can give you one example. Um, in my realm, in my specialty, cardiovascular surgery, aortic valve replacement. We can replace those valves through the leg now in 95% of people. It eliminates the need for surgery. Now we could argue about what age group and what patient population, but the reality is the technology is here. You no longer can do that. So all of these doctors sat on the side like, oh, we're never going to do that. It's going to kill people. It's going to cause it. No, it didn't. Okay. And guess what? You're set over and you allowed yourself to fall into this, oh, me kind of attitude, and you miss out. Don't miss out. Physicians is what I can say to my physician colleagues. Don't miss out on this. Get out of this ego driven, oh, I'm the best thing that ever happened to medicine, thinking and mentality. And quite frankly, I'll be honest with you, Ursula, it's so refreshing, quite frankly, to talk to the younger physicians because they embrace this. They're the most cell phones, social media. They teach me a lot about all of these things. Okay. And I embrace that because that's their world and that's the world to come. We're not going back. We're only going to go forward.
Well, you just said ego driven, and I have to ask you because I've heard many stories about patients that go see their physicians and they tell them, yeah, I think it might be this because I read something and I think like my diagnosis might be different. And their physicians don't like it and feel like, hey, you read 5 things on the internet. I studied for 25 years. So how does a patient deal with that kind of reaction from a physician?
Find another doctor. Find another doctor. Come to the OACES. Come to us. We'll find you a doctor who can communicate with you and respect your agency. And I will tell you, so this happened to me, probably 20 years ago, Ursula. I had a patient, and this was in the early days of Google. I'm not sure when Google started, but I think it was early 2000s or whatever. But I remember a patient coming in with like pages of stuff that they had pulled off of Google. I mean, this was fantastic. The only problem with it is that the information that they brought to me had nothing to do with the condition for which I was saying that. But I was okay with that. I didn't make them feel stupid. I didn't make them feel small. I said, you know what? This is great because what I had was an engaged patient. They were willing now to listen. Okay. And if physicians would get off the high horse, okay, and when people do that and they bring that information to you and they bring in you've got to be respecting, okay, first of all, of their humanity, respecting of their willingness to go out and try to be engaged in the process for themselves. I'm always very open. I love that. In fact, those tend to be the longest conversations that I have because guess what? It's not only an opportunity to create rapport, it's an opportunity to educate. Okay. And then I also know it's really a blessing for me because I know what I have an engaged patient. They're going to understand what I'm saying. They're going to trust me. They're going to allow me to do what it is that I was trained to do. So I feel in no way, absolutely no way threatened by that. So when I say go find another doctor, those doctors are insecure who come back with that kind of snide. And sometimes I do it, but I'll do it in a very, I don't know if you want to very fun kind of way just to get them engaged. Like I used to have this little cup that I would pull out of my drawer and say, oh, your Google search. Well, I have a Google MD or whatever. So, but I would always say, oh, I'm just kidding. Okay. It's okay. I appreciate you. All right. Break the ice. But if you use that to create a defensive or to take a defensive posture, you've just lost the patient. Okay. And quite frankly, yeah, that's a tragedy in my opinion. So I use those opportunities, quite frankly, to elevate. And quite frankly, honestly, I've had people bring me stuff that I didn't know about. And I said, you know what? Never heard of that. I'm going to go and look this up because this may help me with somebody else and not you. Okay. And I'm okay with that. But you can only develop that if you're humble and you're grounded in who you are. Okay. But I will tell you, for a patient, and I'll just say it right out, if somebody comes out with that kind of response and you bringing in information that you've gone out and researched, run, find another doctor. They do not deserve to care for you. Okay. Because first of all, and first and foremost, they don't respect you. Okay. It's not, you didn't bring that in there to challenge their authority or to challenge their smarts or their degree. No, you brought that to them because you wanted to have them have the information that you have. So I would say to a patient who encounters that kind of a situation, run, call me, call Dr. Cooper, and we're going to find you someone who respects you and someone who's going to give you the kind of attention that you deserve.
Loved the answer and loved the story. I think this is what it is all about. Dr. Coop, let me tell you that I loved your answer. And I'm pretty sure many people that are listening to this podcast, because first of all, lots of people are listening to it. I mean, this is like everyone's talking about it. So congratulations.
We're just getting started, Ursula. And I'm so glad. I'm so blessed. You know, God put you where you need to be. I mean, I'm gonna tell you, I have to keep saying this because, you know, when I told Vivek, and Vivek, I said, Vivek, you got to make sure that Ursula is available to do every single one of these podcasts because we are going to rock the earth. And that's exactly what we're doing, Ursula. Let's keep going.
I'm humbled. So people are listening, and I know that many people feel stuck, whether it's dealing with insurance or finding a provider or maybe understanding their options. So it's a lot of information, but what is the first step they can take? That first step that is going to actually change things.
Yeah. You know, Ursula, that's a fantastic question because I thought about this for a while. Is there really one first step? What I want to be able to say and what I can say is that within the next few months, the one step you can take is reach out to us at OACES, okay? Because we're going to have the platform set up whereby this is no longer going to be an issue for you. But I do think that as it stands today, it's very, very important, first of all, that you try to work through the system in which you've been given, okay? And in the setting in which you've been given. You know, you play poker with the hand that you've been dealt, okay? And this is not poker. This is your life. I understand that. But you got to try to work through that. Oftentimes in practices and in dealing with healthcare, there's going to be someone there who's really going to be your advocate. And I will tell you, quite frankly, from my experience as a practitioner for 30 years, I will tell you, I have so much respect, for the nurses and advanced practice professionals that I work with. Those are the PAs and nurse practitioners. I mean, I would, they are more committed, quite frankly, than most healthcare providers that I know. I have to say that. They are really true. They have found their calling. They're there for you. And so I'm talking about, you know, it starts sometimes with the receptionist, the nurse or the MA who checks you into the office, or the nurse who follows up with you about your test results, or the PA who saw you instead of the physician or the nurse practitioner. Those are people, honestly, and I would say that, you know, tap into those resources because they, you know, I just hate to say this. I mean, doctors have been put in a very, very difficult position where they have to, if you will, or they have to see so many. It's almost like an assembly line. It's almost like a used car salesman, you know, sales, you know, sell more, do more procedures, more this, more that. No, but the people that are there in the office, quite frankly, they're not bound by those same metrics. So they can take some time, and they do take a lot of time. In fact, they take a lot of their own professional and even personal time to make things happen for you. So try to tap into those resources. There are community-based resources. There are a lot of online resources. If you have insurance, there are your insurance company, quite frankly, has resources. And if you're not happy with your provider, your insurance company sometimes will say, hey, well, why don't we try this? Okay. Those are resources. You can also put different government resources out there. Okay. That can help you kind of figure out a way to navigate. If it's a particular condition, diabetes or heart disease, or cancer, American Cancer Society, American Heart Association, So these are resources that you can tap into if you're not getting the kind of results, that you think you should be getting. And then again, like I said, in several months, in the few months to come, we'll have the resource open and available, through our platform to help you navigate all of these things.
Dr. Cooper, I'm going to move on to the next question. Because I feel that one of the main problems is that going to the doctor and finding out whether or not you have a disease is a very vulnerable moment for someone. It's a moment where people feel not good about themselves, feel scared. It's not an easy moment. And maybe because of all the information that we have nowadays, maybe because many people are hypochondriac, they have a headache and they think they have a brain tumor and they're going to die. So it's a very vulnerable moment for someone. So if someone feels overwhelmed, where can they turn for trusted resources or support?
Yeah, and then you bring up a very, very good point. And quite frankly, it's why we exist. Okay. It's why we exist at our telemedicine platform at Primo Health Partners, which stands for Professional Resource for Independent Medical Opinions. When you've taken a step back, you've left the doctor's office and things have start to sink in. You can take a deep breath. You can take account, of your own mortality and existence and the totality of whatever morbid, perhaps, diagnosis that you've been given. I think it gets back, honestly, Ursula, at that point to fundamentals. Okay. It gets back to really thinking about the fundamentals of who you are. Some people won't want to hear this, but I'm a very spiritual person. And I told a friend earlier today, that you've got to fundamentally have a belief in who you are, in your existence. I really believe that. And in fact, I really believe that the essence of a lot of what ails people in a lot of conditions is that lack of belief in what our power is and who and what we really are. But that having been said, the perception of that reality is that it creates a lot of anxiety, creates a lot of angst. You don't know where to turn. You feel desperate. And depending upon what the condition is, I think first and foremost, take an assessment of what your surroundings bring you. Okay. And what I'm talking about there is, a loved one, a significant other, family members, perhaps, that you can reach out to and that you can trust, a friend, perhaps. I can tell you one of the most beautiful things that I see is on social media, Facebook in particular, when someone's faced with something very, very dire and they put it out there and you just look at the comments, literally hundreds sometimes of people who are commenting with positive thoughts and prayers and encouragement. I mean, it's amazing. It is truly amazing. So I say you start with the very, very basics. Okay. And that includes your circle of friends, trusted advisors, supporters, and those things. But secondly, I think, again, back to what I talked about earlier, depending upon what the condition is, that you reach out to resources that are already out there available. I mean, diabetes, cancer, heart disease, kidney problems, brain issues, whatever it may be. There is a resource out there, if you believe, that can help give you that confidence that you are going to work through whatever it is, whatever challenge you've been faced. And I will tell you as a healthcare professional and provider, those are the people who do the best when they come to us. People who have the attitude, um, of positivity, of courage, of, undefeatedness. I'm not going to be defeated by whatever this is. I'm going to win, and that winning will be defined by me. Quite frankly, that winning may mean that ultimately you leave the body, but they still won because they won with an attitude of winning. Are they left here with an attitude of survival and winning? And I won't be defeated in my heart and in my mind and my soul. You may have defeated the body, but you didn't defeat me. So I think those are some encouraging words, quite frankly, but I think there are a lot of resources out there to help people navigate the healthcare system when they're faced with a very, very difficult diagnosis and problem that may, quite frankly, be a terminal type condition.
You you give hope when you speak. Everything sounds really hopeful, and I think that's something your patients and everyone who's listening now appreciate it, because
Yeah.
I mean, it's important to find hope.
Yes.
Um, so looking ahead, what do you believe are the biggest opportunities to improve healthcare access? And I'm talking about the next decade. I mean, we could talk about a few years, but let's talk about the next decade. What do you think are the biggest opportunities to improve?
Yeah, I will tell you, Ursula, that I am all in on artificial intelligence and predictive analytics for healthcare. I started following AI 2 years ago when ChatGPT first came out, and started looking for ways that we could potentially utilize artificial intelligence and that technology in our telemedicine business, in our telemedicine platform. And I will tell you that as I've gotten more and more involved in it and looked at strategies and other ways that it's been deployed throughout the healthcare system, I really believe that artificial intelligence, quantum computing, and the convergence of those two is going to fundamentally change so much about how not only we practice medicine, but also, quite frankly, um, diagnostics, medications, treatments, biotech, gene mapping, gene therapy. It's going to fundamentally change how we approach patients in the future. That is here and now, and it's happening. But we are right there just sort of now scratching the surface. Although artificial intelligence and machine learning has been around for decades, it's now beginning to become mainstream because we now have the computing power to make it happen. So I'm very, very excited about possibilities. And so, and when people talk about how these, and of course we should be thinking in terms of how, technology can be used nefariously. But I think, and I see technology as a way perhaps for us to basically minimize disparities and to monitor nefarious types of deployments of the technology in healthcare. So I'm really excited about it because I think, and again, here's one of those aspects that we talked about earlier in our prior discussion about how I think, you know, um, uh, practitioners that are in my generation have to get on board. We have to embrace these because it is the future. This is what's going to happen. I talked to a friend of mine the other day, who was deeply involved with this in the military level, and with artificial intelligence in healthcare. And he and I were saying the same thing. I mean, we can treat one patient at a time with surgery in terms of what we do with our hands. But these technologies have the ability to basically impact care for thousands, if not hundreds of thousands or millions of people with the push of a button. That's tremendous. So that's the future. It's here and now, but it's going to continue to evolve over the next 5, 10 years or decade.
Dr. Coop, I have like 10,000 questions, but I'm going to ask the last question for this episode. I know we're going to have plenty of more episodes. So I'm going to go to the last question of this one, which is, how does OACES Health fit into this vision that you're talking about, and where can our listeners find more information on it?
Yeah. So the careoaces.com and then oaceshealth.com. So those are our websites. How we fit. So OACES is a play on the word oasis, OASIS, is OACES, is a play on the word omnipresent, meaning available anytime, anywhere, all the time, everywhere. Access to care, healthcare experts, physicians, providers, nurses, and services, laboratory, imaging, treatments, whatever it may be. So, our goal and our vision is to create a platform, AI driven. We'll be straight up transparent on that, because this is the wave of the future. AI driven platform that can then help patients and healthcare consumers navigate a very, 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 very confusing, disjointed, disorganized healthcare system. Even in it sounds kind of weird saying that. I've been in healthcare for 30 years. But it's very confusing and disorganized. Okay. And even, with the deployment of, major EHR systems, sometimes I sit in hospitals and I look at the screen and I'm like, wow, I've got Mrs. Jones, and I'm just using that hypothetically, in front of me. And this is just a cacophony of, these categories and that category, but it doesn't tell the story of Mrs. Jones, okay? It seems so inefficient, even today. And if you look at surveys of physicians who talk about healthcare and their frustration, it's still about, technology and how, although it was put in place to make our jobs more efficient, and it has, I have to admit that, okay? And it's made it more efficient, but the fact of the matter is, we have to now comply with standards. Before, it was very, very efficient, but we weren't complying with standards. You could barely read it. I mean, come on. I'm the first to admit it's hard to read my writing. I have horrible penmanship. So what I say is that OACES Healthcare is going to be the platform, the go-to platform for patients to come when they have these questions. We're unique in that not only are we just creating a mobile app, website, there's no disrespect to them, WebMD or some of these other. No, it's not that. We are going to have real people, nurses, doctors on the other end of those conversations or those interactions, saying to you, hey, maybe you need to do this. Maybe you should think about that. Or even if you want to engage with us directly over a virtual platform, we're going to allow you to be able to do that. That's what's going to make us different. And so that's what we're looking for. That's our vision for OACES. We can eliminate all of this disjointment and uninteroperability of systems to help people get the kind of care and access that they need. And again, I have to say that it's not just for patients. I can tell you as a provider, I've been in this game for 30 years, practicing at a very high level. And work at some of the biggest academic and private institutions in America. But the reality is, oftentimes I was practicing and working with a hairstring of information. It shouldn't be that way. We're going to make a difference in that regard. Thank you, Ursula. This is fantastic.
Dr. Coop, once again, congratulations on the success of the Care OACES. I am so looking forward to our third episode. I know everyone is, and we'll see you again in the third episode of the Care OACES.
Sounds good, Ursula. Take care. Have a fantastic week ahead.
You too.